State agencies are an integral part of protecting the food supply in the United States. Each state is unique in how they regulate food products and investigate foodborne disease outbreaks. The duties of state agencies are similar, but the location of work and legal authority varies. In most states, health agencies and agriculture agencies have legal authority to investigate foodborne disease outbreaks and to regulate the food supply. Your state likely falls into this general structure, but specific programs and authorities may differ. Before we talk about how state agencies protect the food supply, let's discuss how they're structured. The type of relationship a state public health agency has with local public health agencies determines the health agency structure. The health agency structure is the organizational and operational link between state and local agencies. The categories of health agency structure include centralized, decentralized, and shared or mixed. Centralized state health agencies provide local public health services that are primarily led by state employees. Centralized agencies do not have any independent local public health units. The state has authority over budget decisions, public health orders, and selection of local health officials. South Carolina is an example of a state that functions under a centralized health agency structure. Decentralized state health agencies are a collaboration between local health departments and state health agencies. They're organizationally independent from one another. Local health units are led by local employees. The local government has authority over budget decisions, public health orders, and selection of local health officials. Massachusetts is an example of a state that functions under a decentralized health agency structure. Shared or mixed state health agencies utilize a shared authority among state and local health services. Local public health services are provided through agencies that are organized and operated by units of local governments in some areas and by the state government in other areas. Texas is an example of a state that functions under a shared or mixed health agency structure. In contrast to the health agency structure, the agriculture agency structure is very different. State agriculture agencies do not have extensive statutory or operational ties with local governments. They may have regional offices and laboratories within a state to assist local governments and businesses, but the legal mandate and practice to work with local governments is not the same as health agencies. Agriculture agencies do not usually have legal or operational interactions with local governments, such as local health agencies. Regardless of how the organizational structure differs among states, state-level agencies coordinate efforts in epidemiology, environmental health, laboratory, and food regulatory programs. Health and agriculture agencies are generally the two agencies that are involved with food safety, foodborne disease outbreak detection, and response activities. State health and agriculture agencies routinely communicate with federal agencies to ensure coordination during multi-state investigations, compliance with food establishment inspections and assessments, and data collection for foodborne disease pathogen surveillance. State agencies are also responsible for reviewing, monitoring, and regulating hazard analysis and critical control point plans, or HACCP plans, mandated by state and federal regulations. In most states, the majority of foodborne disease surveillance and epidemiologic activities take place at the health agency. State and local health programs are responsible for implementing and enforcing laws governing foodborne disease surveillance and outbreak response activities. Environmental health and retail food safety units also have prominent roles in responding to complaints of foodborne disease. They conduct environmental assessments during outbreak investigations and impose control measures during outbreak responses. State health agencies also disseminate information to local health agencies, coordinate multi-jurisdictional outbreak investigations, and provide health education and promotional materials. Local health agencies are an essential part of the national food safety system. Throughout the United States, local public health departments vary extensively. They serve small rural communities with populations of less than 20,000 to those large metropolitan areas with populations of 8 million or more. Local health department operations and resources differ significantly among states due to population size. However, all local health departments have similar roles and responsibilities. Agriculture agencies primarily promote and regulate the production of plant and animal food products within the state. They are tasked with conducting regulatory sanitation inspections at commercial food facilities, such as grocery stores, supermarkets, and warehouses. They also conduct regulatory sanitation inspections at food processing and manufacturing facilities. They may also be responsible for grading meat, poultry, and egg products. Agriculture agencies are usually responsible for environmental health assessments, stop sales, recalls, trace back and trace forward investigations associated with these food products. Programs that are voluntarily implemented by the food industry, such as meat, poultry, and dairy processing establishments, also fall under the jurisdiction of state agriculture agencies. Food establishments are routinely inspected for consumer safety by one or more regulatory agencies, depending on the structure and regulatory authority of your state. Public health and food safety laboratories are generally located within state health and agriculture agencies. Laboratories at health agencies conduct advanced testing on clinical specimens, environmental samples, and food samples. Test methods like molecular fingerprinting are used at state agency laboratories to aid in foodborne disease surveillance and epidemiologic investigation activities. Food safety laboratories at agriculture agencies routinely test water, dairy, meat, environmental samples, and other food and feed products for contamination. They also test these items during outbreak investigations. The Food Protection Rapid Response Teams, or RRTs, conduct integrated multi-agency responses to food and animal feed emergencies in various states across the nation. RRTs are developed through a multi-year cooperative agreement between the Food and Drug Administration, or FDA, and state food regulatory partners. RRTs demonstrate extensive collaboration among multiple disciplines, including partners in environmental health, epidemiology, laboratory, law enforcement, and emergency management at the federal, state, and local levels. The RRTs activate in response to food or animal feed emergencies in their states by utilizing interagency communication, established plans and procedures, and jointly trained staff. Now, let's take a look at how agencies in Georgia protect the food supply. Georgia's food safety system is primarily divided among two regulatory agencies, the Georgia Department of Public Health, or DPH, and the Georgia Department of Agriculture, or GDA. Each agency is responsible for regulating a sector of the food supply based on the type of food establishment. These agencies work independently as well as collaboratively on licensure, adherence to regulations, foodborne illness complaints, outbreak investigations, and environmental health inspections and assessments. In the state of Georgia, the Department of Public Health functions under a shared structure. There are 159 counties in Georgia, which are organized into 18 health districts. Each county and health district receives funding from local governments and the state government. Local epidemiologists, public health nurses, communicable disease specialists, and environmental health specialists regularly work on food safety issues. Counties and health districts function independently but receive guidance from DPH Central Office in Atlanta. Food safety legislation is approved by the state legislature and enforced by county health departments. While some counties may have county-specific regulations in addition to state regulations, Georgia has adopted a standardized food code that is used across all counties in food service facilities. The Epidemiology State Office is responsible for compiling reports of individual cases of notifiable diseases and outbreak-related information, reviewing all data for trends, and investigating possible clusters of disease. Along with the state office, district health departments conduct surveillance on reportable foodborne diseases. District health departments also compile data on counties within their jurisdictions, review those data for trends, and investigate outbreaks. When a cluster or outbreak is detected at the district or state level, an investigation is initiated. These investigations may be led by the district health department or the state office. Environmental health in Georgia regulates restaurants, most mobile food vehicles, caterers, and many public food service events. They also regulate food service establishments located in institutional settings, such as schools, assisted living facilities, hospitals, and detention facilities. The Environmental Health State Office is responsible for issuing guidance regarding state regulations, maintaining data management systems, providing training to county and district environmental health specialists, and providing assistance when requested. The state office may also be involved in outbreak investigations when they occur. District environmental health offices coordinate the activities of the counties within their jurisdictions, determine what training opportunities might best serve their district, and liaise with the State Environmental Health Office as well as the District Epidemiologist and District Health Director. Environmental health specialists are located at the district health departments and county health departments. County environmental health specialists are in the field daily. They license and conduct regular inspections of food service, recreational water, body art, and lodging establishments to assure compliance with all state sanitation and safety laws. They also respond to complaints. A county environmental health specialist would likely be the first person at a facility if a restaurant-associated foodborne outbreak is reported. The Georgia Public Health Laboratory, or GPHL, is a part of DPH. The mission of GPHL is to improve the health status of Georgians by providing accurate, timely, and confidential clinical and non-clinical laboratory testing in support of DPH programs, activities, and initiatives. GPHL provides screening, diagnostic, and reference laboratory services to citizens of the state through county health departments, public health clinics, physicians, other clinical laboratories, hospitals, and state agencies. GPHL conducts advanced testing on clinical specimens, including molecular fingerprinting, to assist in the detection of foodborne outbreaks. GPHL can also test food and environmental samples that are associated with outbreak investigations. GPHL interacts with other state and federal counterparts, including the Centers for Disease Control and Prevention, and is in compliance with all state and federal clinical laboratory licensure requirements. The Georgia Department of Agriculture, or GDA, operates under a centralized structure, unlike the Department of Public Health. Employees operate throughout the state, and they are all employees of the state agency. GDA has adopted the same standard food code as DPH. The regulatory programs of GDA are organized into 6 divisions under the Director of Operations. These divisions include food safety, animal industry, plant industry, fuel and measures, laboratories, and marketing. The Food Safety Division of GDA is responsible for licensure, inspection, and enforcement of grocery stores, manufactured foods, warehouses, cottage foods, and other retail food settings. GDA administers state laws, rules, and regulations for retail and wholesale grocery stores, retail seafood stores, food processing businesses, and manufacturing plants. These establishments are required to obtain a license from the Commissioner. GDA also licenses processing facilities to ensure consumers receive wholesome, safe, and truthfully labeled meat and poultry products by assuring compliance with food safety standards. The Laboratory Division of the Georgia Department of Agriculture provides analytical services to support the regulatory programs of the department. The activities related to food safety include the Food Safety Labs in Atlanta and the Plant Industry Labs in Tifton. The Food Safety Laboratories in Atlanta conduct testing of ready-to-eat food products, ingredients, meat and meat products, milk and dairy products, and environmental samples. Samples are tested for the presence of foodborne pathogens, such as Salmonella, E. coli 0157H7, select non-0157 Shiga toxin-producing E. coli, Listeria monocytogenes, mycotoxins, and other chemical toxins, as well as compliance with other regulatory requirements. In Tifton, the Pesticide Lab and the Feed and Fertilizer Lab test for chemical contaminants such as illegal pesticide residues and heavy metals in food, feed, water, and environmental samples. The laboratories receive samples from inspectors within the regulatory divisions of GDA and report results back to those internal customers. They also receive samples on referral from other state agencies, including DPH, and participate in the Food and Feed Rapid Response Team. The Laboratory Division interacts with other state and federal counterparts, including the Food and Drug Administration and the United States Department of Agriculture, through the Food Emergency Response Network. The Georgia Department of Early Care and Learning, commonly known as Bright from the Start, regulates food service located in center-based and home-based child care facilities. Food service in child care facilities is regulated as one component of the overall care facility. Child care facilities are not subject to the same standard food code as the Department of Public Health and the Department of Agriculture. As you can see, Georgia's food safety system relies heavily on strong communication between two primary agencies. It is important for each agency to understand its role during a foodborne disease outbreak investigation and to recommend proper control measures to prevent future outbreaks. Communication between the agencies is enhanced by the partnership in the Georgia Food and Feed Rapid Response Team, as well as the Georgia Food Safety and Defense Task Force, which include members from all pertinent sections of DPH and GDA. The Department of Public Health and the Department of Agriculture routinely meet to discuss new situations, areas of overlap, and clarification on processes within each agency. Together, these agencies work to keep Georgians healthy by identifying, responding to, and preventing foodborne illness. The next video will introduce the roles and responsibilities of a foodborne disease epidemiologist.